Hi, people.
Hello.
So we thought that we would, instead of providing little tiny self-assessment videos in front of all of your exercises, we thought that we would just do like a mini functional range assessment, functional range self-assessment. So the main difference being, obviously, A, you don't have the eye of a trained professional, but we're just going to hope that you guys can do your best, and feel free to check and recheck, get someone to help you, get someone to look at you, take pictures, videos, because then you can actually see things that you might feel. It's like those memes, this is what I think I look like, this is what I actually look like. You'll notice really funny things, like when we go to do shoulder flexion, for example. I can't tell you how many people, when I say just bring your arm up into shoulder flexion, we get this really funny head stuff going on. You know, like the head is really trying to achieve shoulder flexion, and you won't necessarily see that unless you have an image of that. So get a buddy, get a video camera, do it as many times as you need to get a good feel for where your range is. If you have a buddy, the nice part about the buddy is that you can assess your passive range. So when you're completely relaxed and someone's moving your body parts around, how far does it go before you start to feel tissue tension, or you'll see compensation happening. So when someone's totally relaxed, you're going to see their pelvis start to move. That's what you're looking for. It's a little bit harder when you're active because you're already bracing. So I highly recommend getting someone and training them in the functional range assessment. So we're just going to assess shoulders and hips today, maybe some knees, but we're going to look at capsule space. So the first thing that you need to prioritize is having enough capsule space. The way that we tell whether or not you have enough capsule space is by assessing rotation in that joint. I've said this before, but even if it's not technically a rotational joint like the knee, which is a hinge, has to have some degrees of rotation, otherwise the capsule is too tight. And that is your priority. So if you think about it, if your hip capsule is tight, it doesn't really make too much sense to worry about loosening up your hamstrings and hip flexors and quads, because it's the capsule that's the problem. So first we deal with the capsule, then we start worrying about the more superficial tissues that are involved with linear movement like flexion and extension. So I'm going to have Grayson, he's going to lay on his back, and I'll show you a you've got a buddy assessment and you don't have a buddy assessment. So if you have a buddy, you have them lay on their back, and you're just going to make sure that that elbow goes kind of almost in line with the shoulder, maybe just ever so slightly lower right here. And then you're going to have them relax, which is hard because people like to help. And you're going to kind of put your hand on their shoulder and collarbone area so you can feel if the shoulder starts to come away from the mat. And then you're just going to start rotating the arm down. And when you start to feel other movement, like right here, his shoulder starts to move. So that's pretty much Grayson's passive range. Then if you don't have a buddy, you'll do this with or without. So I would then ask him, can you move your arm there by yourself? And so he can, so his active and passive range is about the same. Then we're going to do the other arm, but we're just not going to do that right now. You go ahead and do your other arm, pause this video. And then we're going to go into external rotation. So he's going to go back this way. Does his wrist touch the ground? Is his elbow maintaining a 90-degree bend? If it does, then we can also assess flipped over on his stomach and see how far we can get that arm to go. So go ahead and flip over. And I'm going to have your head over towards the Dahlinger signs here.
Sorry. Kick your head in the stomach.
Okay, so then what we would do is you're going to kind of hold on to the elbow. It's great if you have a table to be off of, but if you don't, the floor will do. And so I'm going to try to, and it doesn't really go farther than that. So see how his shoulder starts to lift up when I start to pull him farther than that? That is as far as he goes. So then I'll ask him, can you lift and control this movement? And so he basically has, the same range there. Cool. So,
well, my training is paying off.
Yes.
Sort of.
So basically, if you fail internal or external rotation, essentially what that means is that you should be pressing at an incline or doing pull-ups at an incline, because that involves external rotation as the arms, as the elbows have to track underneath your hands to do things. So yes, it's pure flexion, but as the elbow bends, it becomes external rotation. So if you're lacking that external rotation, we want to be in that plane for pressing and pulling vertically. And then if your internal rotation is missing, this starts to really affect people that try to do like sumo deadlift high pulls or Olympic weightlifting with snatching, bench press. So if you really do like a super duper powerlifting bench press where you're really, really arched back, you might be like really maxing out your internal rotation. Same thing with push-ups. So if those pushing movements bug your shoulder, I wouldn't be surprised if we find an assessment where your internal rotation is like here, because then you're trying to bench and it's like, ouch, if that makes sense. So you just have to kind of figure that stuff out and say, like, if I'm negative degrees of internal rotation, no more bench pressing for me. You can incline press. So you would do a little bit more of a lower down incline bench press. Same thing with push-ups, kind of keep those elbows in when you do those push-ups rather than working on that internally rotated shoulder position. Anything else you would add to that?
Not necessarily. I will just reiterate that whatever direction your arm is going, we want that within that range of rotation that you have and not at the very, very limit. So if, say, my external rotation starts here, that's not my best position to press because untrained, that's essentially the weakest part of my joint. So I would like to go a little bit inside that for some kind of incline pressing. If my internal rotation's limited to here, I don't want to press right here. I want to stay a little bit above that just because then I'm not operating in my weakest position. And as we keep training, we get better internal rotation, better external rotation. Those angles are going to change. Your assessment's going to change over time. Just stay within a little buffer zone there.
Yeah. And we do the Pales contractions as supersets to open up a better working position. A Pales contraction is going to diminish neurological tightness. Neurological tightness is a preset that your nervous system is assigning to a joint based on the feedback that it's getting about how well that joint is doing or the joint surrounding it. And so it's just protective. But if you can do work in that position, it kind of tells your brain like, hey, I have a little bit more work capacity here. Go ahead and give me a little bit more access. You probably have access to way more range than that, but that's just what your brain says. This is what I know. This is safe. So you still want to work within whatever that passive assessment says, but the Pales contraction just gives you a little bit more access so that it's a little less sketchy than it would be otherwise.
And it will build up strength in the end range that you currently have over time, so you get, it's good stuff. I mean, really, if you're missing a lot of range, we have to passively stretch that. We don't really do that before we lift. That's sort of a secondary thing, but yeah, stick within your usable stuff.
So with the mains, which are the pull-up, the arm mains, we've got bench press and pull-ups. We're going to do rotational Pales, even though there are so many other components of movement that go into that. So the bench press is going to be internal rotation Pales, and the pull-up is going to be external rotation Pales, and then the other accessory pulling movements are going to be linear motion, if that makes sense. Okay, so then we're going to do a linear shoulder assessment. So I'm going to have Grayson lay on his back, and he is just going to put his arms overhead, thumbs pointing back towards the floor. And so I want to make sure that his thumbs are pretty much right over his shoulder joint. And I want to make sure that his elbows are nice and straight. And I want to make sure that his rib cage is down, that his back is staying in contact with the mat. And so if you see that, if you can touch, if the elbows are straight, if the rib cage is down, that's okay. And then we're going to see if he can turn palms up and go all the way down without bending elbows. So we start to see a little bit of like rotating going on here. So this arm's tighter, huh? Mm-hmm. So this one's tighter in external rotation. You can just see based on how these guys are going down. But are you clear there? And then if you have tons of space there, we can have him flip over onto his stomach and see, just to see if he can go. But this basically says, yes, adequate overhead pressing. If it feels really tight or like it's a real struggle to get there, you might be a slightly better candidate for an incline press, or definitely warm your shoulders up really well before you're doing your overhead pressing.
Stomach or no?
Go ahead, try your stomach, yeah, sure.
I mean, that's pretty much all I got on my back, but let's have fun.
That's about the floor with your, yep, there he is. Okay, cool. So then we're gonna look at hips. So for a hip assessment, Grayson's gonna go onto his back again. And so for this one, we want to have the other leg, the one we're not working with, extended. We want this one bent up. And so it's really hard to get people to relax their legs, but try to stay super relaxed. And you're gonna kind of control the femur so that it doesn't, or your friend, doesn't waggle around here. It stays right over his hip. And then I am, if you want, you can use your hand on the hip to see if you notice any movement. But you kind of stop once you start feeling tense tissues. Like once it starts to give you some resistance, that's where there's some tension in Grayson's external rotation. So then I'm just gonna ask him, can you actively move your leg there? And yes, he can. He's got very good active passive there. And he can probably go way farther in passive range, but you're not trying to max it out. It's just, where is that tension line? That's it. And then the same thing for internal rotation. This is the one where you really start to see the pelvis hike. So definitely keep your hand, just grab that hip. You can grab your own hip if you don't have a buddy. Relax your leg. And then we're gonna internally rotate here. And that's about where I start to feel some tension. And again, just do it as much as you need to. And this is, Grayson had like 0 degrees before, so he's working on his hips.
Wait, you see my active range?
Let's see your active range. Yep, it's great. So
moving along.
you strong. Okay, so then you would do both legs there. So that's internal and external. Again, really make sure the femur tracks right over the hip. And what you're looking for is when the leg starts to take the pelvis. Now, you might be super surprised at when a compensation starts to happen because you might not feel any tension at all, but there might be enough tension in some of those tissues that it just starts to move your pelvis. So one of the more surprising ones are quads and hamstrings for us. So let's go sideways. So next
Do you
up,
want to show the self-assessment for the hip if I had to do this on my own?
yeah.
Real quick, I'm going to take my hand and put it on my hip. I'm going to put my other hand on my kneecap. And again, I can just assess my active range of motion by moving through that, making sure that my femur's twisting, so I feel my kneecap spinning under my hand, and I'm not ever going so far that I feel my hip bone actually moving. If I kept going here, I'm in a side bend, or if I go this way, I start to move my pelvis one way or the other. So simple self-assessment there.
Okay,
Okay.
keep it turning, keep it turning. So normally I would do this, I'll do this leg on this side. Okay, so this is another one that's super hard to get the leg to relax. If you're doing this on your own, you're just gonna take your hands and you're gonna put them underneath that little tunnel of your back so that it stays in a neutral position. And as you lift your leg, when you start to feel an increase in pressure at all with your low back onto the backs of your fingers, that's a stop. So some of us just have so much neurological tightness that when we start to lift our leg up, we'll just feel, it'll just start to go. So go ahead and relax here. Relaxy, relaxy. So I'm going to do it right about there is where I start to feel movement. And sometimes it's easier when you're controlling it, you can really brace and you'll be able to get your leg a little bit higher. Sometimes, not all the time. But when you're really relaxed, it does just kind of really show you where that tension goes. And then the more you do it, the more range you'll get. It's a little bit of another neurological trick. It'll just start to, right about there is where you start to get a little pushy in my hand. But he can probably control this and lift his leg without moving. Yeah, right about there. So a tiny bit higher. Then we're going to assess both legs, but then we're going to assess bent knee hip flexion. So soft, relaxed knee here. You're going to grab onto his foot, and then the same thing. You're going to bend this knee up and in, and when you start to see things shifting and moving, that's when you stop. Right about there, it starts to push into my hand.
That's about where I squat to.
hopefully. So what this tells us, so when you do your straight leg and bent leg, your bent leg is basically what you are really rated to squat to. So if Grayson is squatting, his hip angle, I mean, that's a decent hip angle for a squat, but he shouldn't be deeper than this. So if he squats with his knees out a little bit, that'll give him that room and he should be okay. If he goes past that, it's gonna put a lot of torque on his low back because he's gonna have to fight really hard to not, it's basically just this major fight going on between your core trying to stabilize itself and resist the torque that's happening on that hip joint. Same thing with the deadlift. So if he deadlifts, and granted you don't deadlift with completely straight legs, so it's a little bit of a combination of the bent knee and the straight knee. But if you are doing a straight-legged deadlift, don't go down all the way to the floor unless you have a really good hip angle. So you would do like a deadlift off of risers, you can stack up some bumper plates, you can deadlift out of the rack. It's better safe than sorry for sure. If you don't really know, if you feel like you might not be quite rated enough for a deep deadlift, then just pull out of the rack. It's
nice. Really the whole goal here is that we're training in ranges that we own, because that is what progresses our training. If we're training in ranges that we don't own, all we're doing is causing unnecessary stress on that tissue, and it's hard to make long-term progress that way. So at least this way we can continue to train in the ranges that work, and we can keep expanding those ones that we need more of, but that's a really good way to concurrently do both. So that's the focus here.
Mm-hmm. We're not going to do hip extension.
Knee flexion? Do you want to do knee
Let's
flexion?
do knee flexion. So this is the one that I fail really badly. So what happens to me is when I start to bend my knee, my hips start to roll to one side. So what you're watching here, is for any rolling, and you're also watching for like the buns like pumping up, or back pain, any of those signs. So you're trying generally to keep the legs straight underneath the hip, and then we're trying to, rolling. So he rolls a little bit. Can you see this, how he rolls? And he can probably control that, so go ahead and do it on your own without rolling. So he can control it and then not have that happen, but when he's totally relaxed, there's enough tension on the front of that leg that a little bit of a shift happens. Let's check this side. Relax. Not really the same story here. Also, I'm really pulling his leg underneath him, which is probably tighter. So this one is a little bit better. Is that the knee that bugs you?
Mm-hmm.
Yeah.
Tighter quad.
Tighter quad. So that's that.
If I were to do this on my own, I can just put my fingers right on the front of my hip bones. I'm not going to be able to test my passive range, but I can really easily test my active range. So wherever I start to feel my hip bone move away from my fingertips when my knee bends, tells me that's about my end active control of just my knee flexion.
Yeah. And so as you have been able to see in a couple of these examples, that if somebody is good at bracing and has really good proprioception, they can actively control that stuff. But when you passively move someone around and you see a little bit of compensating going on, you just know that there's still a good degree of tension in those tissues that needs to be worked on. And so in the warm-up where we did quads the other day, we had Grayson's, we were saying like you might not be pushing in what feels like a quad stretch to you. So it would probably be good for him just to do a little bit of work in PAILs at a level that doesn't really feel like it's doing much, but what it can do is teach the leg to work in that position and get rid of a little bit of neurological tightness. A lot of that is probably just neurological tension, not necessarily mechanical tension, because I can actually bend his knee up. So mechanical tension is more absolute. It's like, this is just physiologically where things stop on you, whereas neurological tightness is like muscle tension that is generated by the nervous system. And the neurological tension goes away much faster, and it'll also kind of temporarily go away and then come back. And you have to keep reinforcing good joint mechanics and good feedback with your CARs and your Kinstretch training to eventually kind of really scoot that stuff out. One more thing I do want to mention is that I've had a couple of questions from people that say, you know, my knee hurts when I do X. What's going on? And I can't tell you. No one should tell you, basically. If anybody has an idea about what's going on with your knee just based on you saying, my knee hurts when I do this movement, there's so many contributing factors to knee pain. Basically, any tissue that ties into that joint and the joint itself can have something going on. So that's why we do these assessments. And it's even better to work with someone for a little while, because you might notice that the knee doesn't rotate quite as well as it should. The kneecap's a little sticky, but actually what seems to really resolve this person's problems is working on the bottom of the foot and the soleus. So, you know, it's hard to just say what's going on until you really start working with somebody and getting down in there and seeing, like, you have to just start unraveling compensations. But you just start with the simplest thing. Does this joint function as it should? Let's fix that first, see what happens. If that's not helping, let's look to the next joint. Let's look to the other joint and see if that stuff helps. So it's a little process.
I'm remembering we should probably do wrist extension real quick while we're at it, just because that's for the handstands.
Okay,
You want to do it? You want to talk?
go for you do it.
Okay. Real quick, just because we do have handstand stuff, and generally wrist extension is a common problem for people. Really easy to assess yourself. You're going to start with your hands on the ground and your elbows straight. That's important to keep your elbows straight, because if you bend, it's going to make you think you have more wrist extension. I'm just going to rock back where I can lift my knuckles and fingers off the ground, and then I'm going to rock forward until they won't come up anymore. On this position, I can feel my forearm extensors contracting, but I can't actually lift my knuckles and fingers up, so that tells me that's my end of my active range, which for me is right about 90 degrees. So I'm like barely into that limit where handstands are something that doesn't bug my wrist, but I'm still working to get more because I have aspirations of doing harder stuff than that. But if you're somebody who you get to here and you can't lift your knuckles and fingers up anymore, getting into this position is beyond what your tissues in your wrist can actually do for push-ups or anything else. So we want to adjust that accordingly, whether that's, you know, not doing handstands, doing a modified one where you're not in shoulder flexion, just working again, like all these other assessments, within that range that you actively have. So that's a good one to check for your wrist, just to kind of get an idea of what you're going to do for handstand push-up stuff.
Yeah, and we could get into the knee and the ankle and the spine and the neck and the elbows and all this stuff, but obviously that's a full assessment, which we don't have time for here. It usually takes us about 2 full sessions to go through an assessment with someone, and then it takes us another couple sessions to go over this homework stuff. And then, like we were saying, some folks take a little while of playing around with different things to figure out exactly what they need to be working on to solve their specific issue.
Yeah. So we're going for that minimal effective dose here so we can get through all this cool training for the next month.
Yes. Okay, so that was your little mini self-assessment. Working on capsules, shoulders, and hips, prioritizing that this time around. We're not assessing spine because we're not really doing too much spine training, mobile spine training in this particular cycle. Maybe in the next one. All right.
All right.
See you guys.
Thanks.